Case discussions part 3. This is in regards to a male patient who is 58 years old presented to a clinic with a pretty unusual situation where patient had removable porcelain fused metal prosthesis. Yeah, it was a removable porcelain fused metal prosthesis which was seated on implants. So when we took an X-ray, we were pretty taken aback looking at the picture. We had 8 implants in the upper arch, 8 implants in the lower arch, and still the patient is wearing a removable porcelain fused metal prosthesis. So the first thing what we had to do is to understand what we need to do with this case. Now, I'm told that this patient had about 4 implants in the upper arch, 4 implants in the lower arch, done somewhere else, and then he went to another clinic where they chose to put another 4 implants in the upper arch and another 4 implants in the lower arch, making the entire count to be 16. It's literally like an all-on-8 procedure, which I don't know if the term exists. Now, when we saw this case, the first thing which we were very clear about is no more implants, right? Second thing was we had to retrieve a few implants because one of the implants on the right side of the upper arch had broken. So we had to retrieve that. There were 3 implants on the left side of the lower arch which were placed very close to each other, and it is fairly impossible to load those teeth. In fact, whether it is scan bodies or impression copings, it's difficult to even load that teeth. So what we did is we retrieved a few implants, we buried a few implants, we utilized 4 implants in the upper arch and 4 implants or 5 implants in the lower arch and gave him a fixed prosthesis. So it was imperative that we had to optimize the weight, because if you take a look at this patient, the patient is a vertical grower and his arch is pretty narrow, and we had to make sure that the entire weight of the prosthesis or the load of occlusion is optimized. So what we did is we created a titanium framework and had individual zirconia teeth on this, and the best part is the upper prosthesis was less than an ounce. It was about 17 grams, and so was the lower prosthesis. So the condition here which I am a little disappointed with was 2 dentists couldn't solve the issues, and what they did was only place implants left and right, and they couldn't give a solution. Patient is an elderly person. He literally was emotional when he was talking to me. I think it's a huge responsibility as clinical providers that we give the right solutions and we draft right treatment plans for the patient. Make sure that you deliver infallible results so that they have highest regards for dentists. Thank you.